Hi guys. The client's name is Kana. She is a 20-year-old college student who sought help through her school social worker to address her anxiety and frequent agitation that seems to affect her relationships with her boyfriend, family, and even friends. The client presented with symptoms of emotional dysregulation. She found that she would easily get upset if something didn't go her way, or when her loved ones didn't behave, she thought they should behave. Kana often got into verbal fights with her boyfriend, her sisters, and even relationships with her friends became strenuous. The client described overreacting, often feeling on edge, and even started having panic attacks. The client found herself unable to control her emotions and complained about everyone pushing her buttons. This session will demonstrate the dialectical behavioral therapy, which is known as DBT. This is our third session. The first session was about introduction, assessment, and psychoeducation on what to expect in treatment. In the second session, the client received a DBT skills workbook from which the client learned about emotional regulation skill STOP, which she was assigned to practice as part of her homework, in addition to finding a soothing object for adopting a distress tolerance skill. During the third session, the clip of which you're about to see, the client and therapist used a mindfulness exercise at the beginning to help the client be present in the here and now. They also went over a distress tolerance skill homework assignment. Later in the session, Kana and the therapist practiced interpersonal effectiveness skills give, gentle, interested, validate, easy manner, and how she could have applied this skill to the earlier fight with her boyfriend. Kana also shared her experience with applying emotional regulation skill STOP, take a step back, observe, and proceed mindfully to the situation with her family over the weekend. Throughout the session, the therapist demonstrated establishing a therapeutic relationship, encouragement, and positive reinforcement. Toward the end of the video, the therapist asked open-ended questions about the client's state of anger, her usual senses and behaviors, and introduced the emotional regulation skill technique doing the opposite, which included modeling from the therapist. Research confirms that dialectical behavioral therapy skills training may be an effective alternative treatment for general anxiety disorder, especially for those with complex comorbidities and elevated emotion dysregulation. Training clients to use new skills and behaviors to replace ones that are no longer effective, are unhealthy, and or unsafe is a hallmark of DBT. To evaluate the effectiveness of techniques and skills, the therapist will be continually assessing whether the client successfully improves her coping skills, if she is able to develop effective ways to manage her emotions, and whether her relationships with others are getting better. This will be done by counting the number of incident reports regarding her behaviors, such as altercations with her close ones, amount of anxiety or panic attacks, and or anger episodes, all reported by client. In this short clip, you'll be able to see the shortened mindfulness breathing here and now exercise, how a therapist checks in whether the client was able to do a homework assignment, and practicing a new interpersonal effectiveness skill give, which the therapist suggested to apply to Kana's most recent fight that happened right before the session. Hope you'll enjoy the presentation and looking forward to your feedback. Thank you for coming in. I know you wanted to cancel, so great job.
Yeah, I was really not feeling good, and I didn't really want to come today, and I was just feeling like really nervous, and yeah,
Okay.
didn't feel like coming.
How about before we proceed, we practice some here and now exercise, so we both get grounded. I could notice your body language a little off. Do you mind doing that with me?
Okay.
Okay. So I don't want you to think about what happens hour from now or hour before what happened. Just you're here and now. Is this a safe place? Do you feel comfortable closing your eyes?
Okay.
Okay. How about you close your eyes and take a deep breath for me. And blow out gently like you're blowing out a candle. Good. You feel better?
Yeah, it feels good.
Okay. Before we go ahead, I wanted to ask if you were able to find an object that we talked about, the stress tolerance skill. Something did you bring?
Yeah, I got this ball. It's like one of those like stress balls. And it just like feels really good when I like, it just helps me kind of like press into something when I'm feeling like a lot of like tension, and like it just, I really like playing with it. Yeah.
Okay, wonderful. I'm really happy to hear that. Fantastic. Great job for doing homework. So do you want to tell me what happened before the session? Yeah, I'm sorry to hear that. Yeah, but I got the picture. Thank you for sharing that with me. Well, maybe we can apply one of the exercises that you have in the handbook that I gave you last time. It's an interpersonal effectiveness skill called GIVE. Just super easy to remember because it's GIVE. And I think it's on page 26 in your handbook. Do you want to open it for me? Okay. Let's practice how would we can apply this acronym to the fight that happened with your boyfriend, starting with gentle. What do you
yeah, I guess I wasn't very gentle. I guess I got really upset really quickly. So maybe if I would have like not yelled and would have spoken more calmly and not yelled at him. Yeah.
Okay. And next is interested. What do you think you could have done there?
Maybe like listen to his perspective and his idea instead of just saying that it was like stupid or whatever.
Yeah. I think that would be good. Validate. What do you think that means?
Like, I get why he wants to stay home, just the two of us, because it's Valentine's, but like, I just don't want to do that. But like, I can, even though I don't think it's a good idea, I can like understand why he thinks it's a good idea.
Okay. Yeah, like understand his perspective, right? Validate his opinion. Do you want to do a quick role play? Tell me, how would you tell him, like if I'm your boyfriend?
Like, I get why you want to stay home, but I think it'd be more fun if we went out with our friends.
Okay. Yeah, something like that, right? Just hear what his side of you, and then what easy manner would mean for you.
Does that mean like being like calm and like friendly and like not attacking him? Is that what that means?
Yeah, maybe a smile, right? We usually make cringy faces when we fight, our body language. So maybe relax and smile at the end, or just while you're talking to him.
Yeah, I guess it'd be pretty funny because usually I'm like really upset. And like if I started smiling, it would probably make me laugh.
maybe the whole fight would have turned into a joke. You never know. But our body language and demeanor means a lot, right?
Yeah.
So how do you feel? Do you think you would be how do you think that would change the fight, or how would make you feel about?
I think it'd be really hard. But I think if I did those things, for sure it would have gone differently and I wouldn't have been upset the whole day. Probably would have had a better day.
Yeah,